to summary, let's talk about hematology. Hematopoiesis means making of blood. Hemato means blood, poiesis means making of. Hematologist is a person who studies, logi, studies blood, hematology. A person who studies and treats diseases and disorders of blood. Cancer is studied by an oncologist. A person, oncologist, specializes in diagnosis and treatment of malignant disorders, malignant indicating cancer. How do you define cancer? It's an uncontrolled, it's a class of diseases presenting with an uncontrolled, you can't control it, division of cells. White blood cells, another term is leukocyte. Leukos means white, are associated with a type of cancer called leukemia. Leukos means white, emia means blood. When you perform a venipuncture, when you puncture the vein, you draw blood and spin it in a centrifuge. Blood is normally drawn around the cubital fossa. That's the fossa between the arm and a leg. And the needle has to pass through the tunica intima of either the veins, more commonly, and rarely the arteries. This tunica intima is composed of a single layer of endothelium that sits on the elastic lamina. Compare this to capillaries. Capillaries only have one cell thickness in terms of endothelium, and our capillaries are only one cell thick and are also obviously the smallest in diameter blood vessels in the body. Arteries and veins both have their own specialties. Arteries, especially the larger ones, are extremely muscular. They need to push that blood around, send it to the rest of the body. Veins, on the other hand, have to make sure that the blood goes unidirectionally in one direction toward the heart, and so they have valves to prevent a backflow. Valves similar to the valves in the heart. They direct the flow in one direction only. So you do need to know a term called many arteries itis. Polyarteritis is an inflammation, i.e. itis, of the blood vessels involving many arteries of different sizes. They may be small, medium, or large. Please compare this term to vasculitis. Vasculitis involves vasculature. It can be either arteries or veins. All right. Polyarteritis implies many blood vessels, not just one. All right, and we'll discuss this in endocrinology as to how you take care of polyarteritis. We use corticosteroids. Corticosteroids decrease inflammation and are very commonly used in all autoimmune diseases. All right, now after you've collected blood via venipuncture, you actually get whole blood. Whole blood contains cells, that's the formed element that precipitates after you spin it, and plasma. I asked you a question, what's the difference between plasma and serum? You're going to see that in a few. So when you spin that blood, the whole blood, what happens is that the bottom of the centrifuge is reddish because most of the cells in blood are red blood cells. There are three types of cells: red blood cells, white blood cells, and platelets. Another name for platelets is thrombocytes, and this whole collection of cells in a test tube that goes to the bottom is called formed element. Please remember that every single blood cell, all blood cells, are made in the red bone marrow. Never answer anything else. There are no exceptions in a healthy patient. There are some exceptions in pathological cases. So, when you spin the whole blood, the top is called plasma. Plasma is made up of water, more than 90%, but What is the difference between plasma and serum? You absolutely need to know that plasma without clotting factors is called serum. You also need to know that clot, when it retracts in whole blood or in plasma, we call it syneresis. Syneresis. Please don't forget, plasma can clot. It will form serum. Serum cannot clot. All clotting factors were already used up to make serum from plasma. Do know that albumin is the most predominant protein in plasma. Be very familiar with albumin. It's the protein that keeps water in the blood vessels via oncotic pressure. Some people say osmotic pressure, oncotic pressure. Now let's talk about red blood cells. Red blood cells are the most common cells in blood by a margin, and they look like a number 8, sort of. Okay, so they look like a biconcave. This is the concavity. Concave. Both sides are concave. Form a little cave. Look at that. Biconcave disc. The number of RBCs, the red blood cells in the body, is controlled by a hormone that's produced in the kidney, and that hormone is called poietin. Poietin, we already talked about hematopoiesis, so making of, and that hormone is called erythropoietin. Erythros means red, so it's the hormone that makes red blood cells. All right. Why is it important that the red blood cell looks like it does, like a number 8 sort of, a biconcave disc? Well, it allows it to increase the surface area and to function and perform its function better. Its function is gas exchange, both oxygen and carbon dioxide. It increases the surface area. Plasma membrane of RBC is increased in length if you were to straighten it out. So do know that approximately 1/3 of all the red blood cell volume is made up of hemoglobin. 1/3 of all of this red blood cell is made up of, volume-wise, is made up of hemoglobin. Function of hemoglobin, purpose of life, is to bind and to transport gases. The two gases that we care about the most are both oxygen and carbon dioxide. Hemoglobin is the carrier of oxygen and carrier of carbon dioxide for a living. It goes from lungs to the periphery, from periphery to the lungs, and gas exchange happens in the capillaries. If red blood cells are decreased or damaged, we call that disease anemia. Don't forget that when red blood cells are decreased, what happens is that the hormone produced by the kidney, called erythropoietin, increases to drive the production of red blood cells. And to increase the production of red blood cells. Similarly, if there are way too many red blood cells due to whatever reason, that is going to tell the kidney, hey, I don't need so much of you, erythropoietin. I'm good. Do not make that much erythropoietin. Please conserve it for the times when I actually do need it. Blood type. You absolutely need to know the blood type. For that, you need to understand what antigens and antibodies are. Antigen, think of it as an antibody generator. Antibody generator. Antigens are surface markers found on top of the RBC in plasma. So red blood cells have things sticking out of them, and those are their ID cards, and we call them antigens. Why do we call them antigens? Because they can generate antibodies. Antibody is what your body made to protect your body. Antibody is what your body made to protect your body. When red blood cells stick together, we call it agglutination. And that agglutination is a transfusion reaction caused by mismatched blood. Blood has different blood groups. You know yours most likely, A, B, and O, and AB. So A, AB, B, and O, four blood groups. And if you have a mismatch, that means to a blood group B, you give blood group a donor blood, we will have blood clumping together. This is called agglutination. And that's the result of a transfusion reaction. How do you remember which group is what? Blood group A, it's very easy. It's really easy. Blood group A has an A antigen, antibody generator. A tag. Blood group A carries the letter A. All red blood cells in blood group A carry that tag. I have an A on their red blood cells. Therefore, they don't want any B cells to enter, so they carry anti-B antibodies in plasma. Similarly, blood group B have B antibody generators, and so antigens, and so they don't want any strangers with a tag that has an A. They don't want any red blood cells with a tag saying A. So they have anti-A antibodies in the plasma. Blood group AB has A and has B on the red blood cells, both 1 and 2. It's not an AB antigen. It's both A and B antigen. So they have both of them on those red blood cells. Because they have both of those A and B antigens on the surface, they do not have any antibodies because they would otherwise harm themselves. There are no antibodies other than anti-A or anti-B antibodies. These blood group patients or individuals do not have antibodies to A. They do not have antibodies to B. So you can give them any type of blood and they are universal recipients. Alternatively, blood group O stands for a 0. They don't have any antigens, no antibody generators, no antigens. These guys are universal donors. They can give their blood to anyone. Why? If someone has anti-B antibodies, they don't have antibodies against 0. You can't have antibodies against a nothing. O is a nothing. There are no antibodies against O. So, patient who has blood group A can get O. Patient who has blood group B can get O. Patient who has blood group AB can get O. That's why we call blood group A universal donor. And one thing is really interesting, that the plasma of blood group A patients has antibodies against both anti-A and anti-B. Antibodies are present in the plasma. What does that mean? It means that you cannot give any cells that have a B tag, that's the blood group B. You also cannot give cells with an A type, that's the blood group A, to a patient who has blood group O. Nor can you give patient who has cells tagged with A and B. There is another blood group, a very small blood group that is occasionally important, and that's the Rh blood group. And this Rh blood group has individuals who have an antigen called D. So we had a B antigen, we had an A antigen, we had cells which have both the antigens or no antigen, right? Now we're talking about a patient who has another antigen, not A, not B, it's called D. It's a very special case. This antigen belongs to the Rh blood group. Rh stands for rhesus blood group, which this antigen was first found in rhesus monkeys in Africa. That's the name. So Rh, in this case, the problem is as following. Sometimes mothers do not have this D antigen, but the babies do. We call the baby positive for D. We call the mother negative for D. If a mother who is negative ever sees this D antigen, because baby's blood accidentally gets into mommy's blood, the mommy will make antibodies to that Rh positive baby's RBCs, the RBCs that have the D antigen. In order this will happen, what this will do is that, so to prevent mom from killing baby and baby's red blood cells, we give the mom medication called ROGAM. ROGAM does something very interesting. It protects the fetus in this Rh negative mother and prevents this disease called erythroblastosis fetalis, or the hemolytic disease of the newborn, because it kills whatever red blood cells the baby had enter mom's circulation. So any of the accidentally cells that have accidentally wandered, babies, any of the baby's red blood cells that have accidentally wandered into the mom's circulation will be killed. And so fetal death will be prevented by ROGAM. We got to give ROGAM before delivery and after delivery. So don't forget that ROGAM kills fetal RBCs in a mom, and so no antibody. Let's talk about the white blood cells now. White blood cells have granulocytes and agranulocytes as two types in which they are differentiated. Granulocytes, cells with granules; agranulocytes, cells without granules. Granulocytes are basophils, eosinophils, and neutrophils. Ben. These contain some granules, all three of these, and they are formed in the bone marrow just like all other cells. The most common granulocyte and the most common white blood cell overall is called neutrophil. Neutrophil is a granulocyte. It's a part of the Ben cells. Don't forget that all granulocytes are white blood cells, and therefore all neutrophils are white blood cells. Another term for white blood cells is leukocytes. Neutrophils are very important cells in an organism's response to a bacterial infection. Neutrophils are elevated in bacterial infections. You also need to know other granulocytes, such as basophils, which secrete a chemical called histamine, but also heparin and serotonin, among others. Histamine is extremely important for an allergic reaction. Eosinophils are the third type of granulocytes. BEN, basophils, eosinophils, neutrophils being the greatest in number. Don't forget that natural killer cells, NK cells, are not are lymphocytes, but they do belong to the group called granulocytes, and normally we just group them with lymphocytes, however, and don't care too much about their granules. So B and T lymphocytes, which are a special group of white blood cells important in immune defense. B and T lymphocytes do not have those granules. We also have other white blood cells, monocytes, other white blood cells, leukocytes, that are in blood, and which then leave blood and enter the tissues, where they increase in size, and we call them macrophages. Well, these monocytes also do not have granules. Only Ben cells have granules, and Ben and natural killer Is Ben a natural killer? I don't know. Whatever helps you to remember. Ben, natural killer cells are all granulocytes, rest are not. So what do monocytes do? They provide among others, immunological defenses against many infectious organisms. Don't forget that neutrophils are elevated in bacterial infections. Monocytes are also involved in defenses against infectious organisms, and they often just phagocytose, eat up the cellular debris in the tissue after they become macrophages. Lastly, let's talk about platelets, also known as thrombocytes. Thrombocytes are and platelets, same thing, are very important in preventing blood loss. What they do, let me describe it very quickly. So we have a damage to the blood vessel wall. Platelets just form a platelet plug, like a stopper to prevent blood loss, nothing else. Where do platelets derive from? They derive from megakaryocyte, the mothership, mega large, the largest blood cell in the bone marrow, called megakaryocyte. And thrombocytes are fragments, chipped off fragments of cytoplasm of those large cells that are sometimes discoid in shape, and they definitely do not have a nucleus. We're talking about fragments of the cytoplasm. Another cell that does not have a nucleus is the red blood cell. Red blood cells and thrombocytes are the only two cells that do not have nucleus, whereas thrombocytes are generally considered to be just discoid fragments and not really cells. Their cell, the mothership, is the megakaryocyte. So as I mentioned, thrombocytes help in blood clot formation. They do have certain granules in them. Those granules are extremely important in clotting. But what blood clotting means is nothing but a formation of fibrin. Fibrin is body-owned superglue that actually helps this newly formed platelet plug to stabilize. And this stabilization prevents blood loss at an injury site. So blood clot means thrombocytes plus fibrin. And fibrin is something that you need to think of as a glue. So thrombocytes plus fibrin is your thrombus. Thrombus is thrombocytes plus fibrin. And you got to think of a thrombus like a bus because it sometimes can move. A thrombus is when it moves, let's say a piece of blood clot. A blood clot is a thrombus. Among others, anything else as well, fat, air, or anything else that moves, dislodges, and then is transported by the bloodstream like a ball. Like a ball, we call it an embolus. Embolus like a ball. So, when do we see emboli? When we have thrombi. Thrombi are usually made when we have blood not moving, blood stasis. When blood clots too easily, coagulation is the word for clotting, so coagulation abnormalities. And when the endothelial lining of the blood vessel is injured. Those three things promote thrombus formation. So, who is responsible for the final step of making the superglue? Well, there is an enzyme called thrombin. Thrombin is an enzyme in blood, and what it does is that it makes fibrin. Fibrin is also known as factor 1A. Fibrin is made by thrombin from fibrinogen. Fibrinogen generates fibrin, makes fibrin. What is fibrin? Fibrin is the super glue. Fibrin is the glue of the clot. Don't forget that fibrinogen is safe. If someone asks you what does clotting mean, you essentially think that clotting is a process of making of fibrin. There is no fibrin, there is no clot. Okay? Do know that there can be no clotting if any of the clotting factors are absent, because these are all the clotting factors, 12, etc., 9, 11, 8. What they do, they are like dominoes falling on each other, ensuring that the final step, making of the last domino, fibrin, making of the last domino, which we know as fibrin, is done from domino that is the second last, and that would be fibrinogen. For example, hemophilia is a disease where there's a problem with clotting factors, so there is no clotting. Clotting factors act in a domino-like effect to make fibrin. Please think about it. You do need to know that vitamin K is a very important vitamin required to make some clotting factors. If vitamin K is not produced by the colonic bacteria in colon, literally. For example, if a patient takes too many antibiotics or does not respond well to those antibiotics, hemorrhage is possible. Hemorrhage is an equivalent thing to hemophilia. Hemorrhage is, in this case, in antibiotic overuse because there are clotting factors that are lacking, and so blood cannot clot. What does it mean when blood cannot clot? It means that there are either no clotting factors. It may be that the patient has a disease called hemophilia, or the patient doesn't have vitamin K production, because vitamin K is responsible for making clotting factors. No coagulation is possible in absence of clotting factors because fibrin is not made. Fibrin can, if the body makes too much fibrin, it sometimes realizes it because body cannot tolerate too much of superglue swimming around in blood, sticking cells to each other and causing havoc. So fibrin that is extraneous, that is more than the body can tolerate in cases of homeostasis, is broken down by a body-owned enzyme, an endogenous enzyme called plasmin. What plasmin does, it lyses fibrin, dissolves it, and we call that process fibrinolysis. Fibrinolysis, please do know it for your NCLEX. Now, let's talk about decrease of thrombocytes. As I mentioned, thrombocytes do not cause blood clotting. They only activate blood clot formation. They just start that first domino down the path. They just push the first domino and make it fall on the other ones, okay, among others. But what platelets do is that they form a platelet plug. So if there are no platelets, bleeding is prolonged. I didn't say clotting. I said bleeding is prolonged. So the patient's pipe, the blood vessel, is damaged. There is no plug that ever takes up that space, and so the patient will be bleeding for a long time. Do not confuse lack of platelets with a hemophilia. Hemophilia is a lack of clotting factors in blood. These are all proteins that cause clotting. There can be no clotting in hemophilia because there are no factors. You need to know that it's factor 8, or it can also be other factors, 9 and 11, but do know factor 8 down the road. So clotting is hemophilia, clotting of blood. And this is the action of blood proteins. Platelets are just cells, cell fragments that form a platelet plug to prevent bleeding. worn out red blood cells and platelets are phagocytosed in the spleen. That's a very important factoid that you need to know because sometimes spleen is enlarged and this is called hepatosplenomegaly. We don't call it megaspleen, we call it hepatosplenomegaly if the liver is involved, or just splenomegaly if it's only the spleen involved. So what happens then is that the dead red blood cells produce hemoglobin. Hemoglobin contains iron, and this iron is released and then stored in the liver among other places. Okay? Thrombocytes and erythrocytes are the only cells that do not have a nucleus. Please remember that. I already told it to you earlier. Thrombocyte elevation is called thrombocytemia. Hemia means blood, too many thrombocytes. Do not confuse it with thrombocytopenia. Thrombocytopenia is a term for a decreased number of thrombocytes.